The environment has to be
What we are saying is have a heart.
We've got to be able to regenerate our
There'll
economy.
be people who are kind, people who are cruel, but that's life. You can be passionate about videos. I'm fine with that.
I'm given to understand that an aesthetic physician earns about $100,000 a month or more. Now that comes to about 10 times more than what a GP would earn in a month. That is why so many physicians want to go into aesthetic surgery. But also one of the reasons why people run to the physicians is a matter of cost, isn't it?
Sure.
Yeah, it's
That's
much
just
cheaper.
economic reality.
Yeah.
And that's the same reason why people go
So
to
if you're-
Korea or Thailand or any of the other countries to do their surgeries.
And
Okay.
I think other than cost is also the volume of work. If you want to have a Botox done, you will look for the guy who has been doing Botox for the whole day, 365 days a year, versus the guy who might be spending half a day doing his surgery, maybe spending 10 minutes doing Botox.
Oh, sorry, I can't agree with that. Because the guy who's doing a lot of surgery has a much deeper understanding of facial anatomy, much more than any non-surgeon, which I think is very important in delivering good results with Botox. So numbers are important, but numbers aren't everything, because you can do
Experience. I think Bernie's
can
talking
do-
about experience and frequency of that experience,
Yes,
right?
but by the same token, you can do something 1,000 times to a mediocre standard. You can do them 50 times to a higher standard. you see.
No, but
That's my
generally
point.
speaking, a person who does something more frequently is more adept at doing it, right?
And I don't think I do any fewer Botox injections. I probably do more Botox injections than the average cosmetic physician in Singapore because of the numbers of
It's
of my
very
practice.
popular, is it?
It's
But
a
why
question-
are the rates for plastic surgeons more expensive than for physicians?
Why does a Ferrari cost more than a Toyota?
Branding.
I don't
Not
think
because
so.
of service provided, looks.
You don't think a Ferrari is better than a Toyota?
For me, no, because I drive a Toyota and I'm quite happy.
But if you've never driven a Ferrari, then you're not in a position.
I see a Ferrari and it does nothing for me. I don't get excited by
But
it.
try
at all.
driving one. You'll be seduced.
I
by
probably
it.
won't enjoy it because I don't like fast cars. Okay. But in a procedure like Botox, is it that crucial?
It depends on what kind of standard you're aiming for, you see.
Okay, let me put it another way. Do you think then there should be a table of fees in Singapore for certain simple treatments or certain treatments so that the patients can then go to the best doctor available rather than the cheaper doctor?
Even between plastic surgeons, there will be differences in price as well, and that's based on our perception of what we can deliver to the patient.
So
and whether the
natu-
patient is happy.
That's right. So natural economic forces will ensure that the doctor who overcharges and doesn't deliver isn't going to survive because he won't have patients.
So the fact that if a doctor can command a higher fee and charges for it, that's really a business decision that they deserve it because of their
No,
greater expertise.
it's not only a business decision, it's also a technical issue. Because let's take a rhinoplasty, which is a nose job,
Nose job,
in,
okay.
in common terms. You could go to one surgeon who does a rhinoplasty by making a little incision and stuffing a piece of silicone in, and it takes half an hour. All right. You go to another surgeon who does a rhinoplasty and opens everything up, takes cartilage from the ear or from the rib and fashions the new nose, trims everything down and puts it all into position, and takes 3.5 hours. Can you equate the two
That's
rhinoplasties? You
fully
can't.
justified then.
It's a different level of work.
But are you saying that that applies to Botox as well?
Botox, there are many variations as well. You can have Botox, for example, in the area of the brow or the glabella. You can do 1 or 2 or 3 injections, or you can do 7 injections and get a totally different result and charge differently as well.
Yeah, I totally agree with that. It's
Okay.
not as simple as it seems.
And to go back to that other point about Botox being simple and everybody can do it. Everybody can do it if they've been doing it often enough and if they're learning and observing what the results are coming back. But for example, this thing about facial slimming, many of the GPs who are doing cosmetic medicine may have forgotten or may not even know that I actually invented that term as well. Botox facial slimming was coined by me. I wrote the original protocol for.
What are you
again,
talking about? The narrowing of the jawbone?
narrowing of the face with Botox for cosmetic indications. That protocol was written by me many, many years ago.
It depends on where you inject it, right?
Yeah,
Now-
for that I do agree.
And where do you apply Botox to?
I do apply to remove the wrinkles over the forehead, the crow's feet, which what we call at the side of the eyes, as well as on the nose bridge, and as well as over the chin, gummy smile. It can be applied over the whole face, many indications. But going back to the earlier point, I do agree that plastic surgeons have a great training in anatomical muscles, and their knowledge is good. But if you compare to a physician who has done Botox for 10 years and a newly graduated plastic surgeon who has been spending his time doing surgeries, then I think it might be fairer to say that there are different standards involved. The aesthetic physician might be able to give a better job in terms of Botox injections than the newcomer in the scene.
And he will be judged by his results, really. Right?
Yeah, at the
Like
end
any
of the day,
doctor.
it's what we deliver, the results.
And what their friends see
Yeah.
out there. Is it more litigious as far as plastic surgeons are concerned? Do you have patients that tend to want to have higher expectations and more contentious? And,
Yes.
yeah.
Yes, that is a fair
More
point.
so than a general physician?
Let's put it this
Yes.
way: all doctors pay medical
Insurance.
insurance. They pay the highest rates.
Can we move into another area before we close? We are seen as a center for cosmetic surgery. Are we able to hold on to that preeminent position, or are we losing ground?
I think unless we make some radical changes, we are losing ground.
Why are we losing ground?
Well, there are a number of factors. We wanted to be a medical hub, but I think we are
we are actually recognized as a
well
medical
in terms
hub,
of
right?
standards, but we are pricing ourselves out of the market.
Why
Kenneth-
are we pricing ourselves out
No.
of the market?
Well, the cost of running a business here is much higher.
What,
But
you're talking of rentals?
even
or-
with regard
Everything.
Staff,
staff,
Rental,
rental,
salaries.
yeah, salaries, even buying things from your medical distributor, because they have to get everything licensed, regulated. They have to pay the ministry to license a packet of gauze. They
The
will pass
HSE.
those costs back to the physician, and the physician has no choice but to pass it back to the patient. But when you compare the structured and the restructured hospitals and the private hospitals, there are patients coming from overseas who even find the restructured hospital rates too high, and they will go to another country.
Yes.
And this is a problem that we are facing, and it's something that we should address, because slowly we are seeing a drain of finances from the country to our neighboring countries. And part of this is to do with advertising. And here I'm going to say something about the advertising guidelines in Singapore with regard to physicians and those who are practicing cosmetic medicine. We are not allowed to put before and after photos on our websites. Isn't that bizarre?
Singapore doctors.
Singapore doctors. Now, if somebody is going to go to the internet and wants to know what a double eyelid looks like, and they click on, let's say, my website, and they come to it, and there's just written words there on what the procedure entails, but they want to see a picture of a before and after.
Yes.
They
That's
can't,
one of the most
because
effective
we're
things.
not allowed to. Why? Because the government or the Singapore Medical Council deems it as laudatory to put a before and after picture, and we've gone to them and said, how can this be laudatory? It's just educational.
But
And
however, plastic surgeons in Thailand, Korea, and all other Asian countries are able to widely publicize and show their before and after pictures.
So, all things considered, if you're looking at, let's say, Korea, why is there a big drain going to Korea? Well, all their websites are unregulated, really. And you can just, if you want to see what a double eyelid or a rhinoplasty looks like, you can click, you see a Korean website, just click on that, you see a whole gallery of pictures. Of course, you as a prospective patient will be impressed. And I have actually had patients write to me and say, you don't have any before and after photos, why should I come to you?
How important is it to you as a consumer?
I think to a certain extent it is important because you need to see what are the results, and you need to see testimonials of patients who have done it before certain procedures, and from there you can get a gauge and sense of what's the competency of this clinic or this practitioner. Yeah.
That's a very good point, Faith. Testimonials. Do you know that testimonials are
Very, very
explicitly disallowed?
Disallowed.
Disallowed. And here you have a consumer saying how important it is. So, you know, it's very anti-business, if you like.
Okay, was that regulation formulated in relation to competition between doctors in Singapore without maybe having recognition of the fact that you also face competition from overseas?
Probably.
Historically, that's
Yeah,
probably
but
correct.
they have not seen fit to change that rule. And that is to our detriment as a whole.
And may I ask again, has representations been made?
I have been writing to the ministry for the last 9 or 10 years, to the point that I'm sure they're anesthetized to any letter that I send in to them.
Okay, can I ask how serious is this problem? If you say that you are at a disadvantage and you have competition for aesthetic surgery from Korea, how serious is it a problem? How much business are you losing from Singaporeans and from people in the region not coming to Singapore?
I think significantly, and I think even Bernie will be feeling it too.
Yeah, significant.
All the physicians in Singapore practicing cosmetic procedures are seeing a drain of patients to other countries. And it's a pity because that revenue could have been used to keep within the cycle.
But doesn't that cheapen your profession? I know that in Bangkok there is
It
a
does, you know.
Yan Hee Hospital, and they display number boards outside their specialist clinics with statistics about how many nose jobs they have done, how many breast implants and things like that.
Not only that, they will tell you how many Singaporeans they've seen, how many Indonesians
Okay.
they've seen.
Is that going too far? Is that cheapening a profession? Or do you think
Absolutely.
Absolutely.
Actually, there's one other thing I want to bring up before
Go
we
ahead.
close. It's this thing about the traveling physician. If a Singaporean physician goes to another country, they need to have a practicing license to give a consultation or to do a treatment
the license given by Singapore or?
by the
other
country that
country.
we're going to.
Okay.
And if we are found out or if a complaint is made, then we are liable for the high jump as far as the Singapore Medical Council is concerned.
Okay.
Whereas what is happening with the Korean scene is these clinics from Korea send their emissaries to Singapore, Malaysia, and they have private consultations in the hotels, which strictly is not allowed because a clinical consultation is still a consultation.
How do they get the business? Then they bring the patients over to their
Yes,
country?
because they consult. Faith may go and see somebody in Amara Hotel and see a plastic surgeon from Korea who examines her and tells her, okay, you come to Korea, this is the surgery that's going to cost X number of dollars, we'll look after you, we'll find the hotel for you. And of course she's going to be feeling really happy because she gets a consultation with a surgeon and she doesn't have to pay for it. Again, this is an example of an unfair situation.
That is allowed.
Where we can't go out to another country and Martin
do
and I
that.
can't go and hold a clinic in Indonesia because we get in trouble.
But again, you're saying that on the one hand, they are very strict with our doctors here, that puts you at a disadvantage in relation to competition from overseas, and on the other hand, they're too lax with foreigners coming into Singapore to
Absolutely.
eat your lunch.
In a way.
Okay,
And dinner.
okay.